This is a presentation of my capstone project, promoting bonding with mother and baby. My practicum setting was on a mother baby unit here in Baptist Louisville. They have a total of two postpartum units, 20 beds on each unit. They have centrally located a nursery and the NICU in the middle. They also have heavy focus on mother baby bonding. Um, Mother baby unit in Baptist Louisville practices rooming in for the majority of mothers. They do offer nursery services to mothers as well. There are some babies that need to be nursery babies, meaning they need just a little extra care, but not NICU care. And with the NICU also being centrally located near the nursery, mothers on the postpartum unit that babies have babies in the NICU also have access to their babies very easily. It's on the same floor, right outside the doors and through the nursery. The learning goals from our project was to identify and define the mother baby bonding techniques used, define the barriers that mothers and babies face when doing the bonding, explain the process of implementing bonding and the techniques used, and identify education needs for mother baby nurses when it comes to bonding during hospitalization. Also, education that the mothers need for bonding with their baby. Sometimes, even if it's their second or third baby, they don't know how to initiate that bonding because maybe the first two babies, it was easy. Maybe this third one, the second one, there's something stopping them. They're not sure what to do because the first baby was so easy. My learning objectives and plan were to identify these barriers and define those, uh, research the best available evidence-based practice, and make sure I had up-to-date references for how to help facilitate the bonding. Work with the nurses to educate them on new developments on the bonding process between the mother and baby. And I was able to find that something they were telling mothers is actually not completely true. So we'll get into that here in a second. So, observe bonding techniques. Rooming in was practiced and encouraged at the clinical site I was at the Baptist Hospital and here in Louisville. What I observed were nurses were also very careful to also let the moms know that the nursery was there for support. This is also kind of where we had a little bit of issue of what the evidence says on using rooming in and using the nursery as like babysitting, as Baptists called it babysitting. If you were to send the baby to nursery for the night or something like that, that's what they would mark the baby as. It was a way for them to define if this is a nursery baby. Are we doing something for this baby in the nursery while they're here? Or are they there just to let mommy and dad or parents, whoever is there, uh, get a rest? So they also had Zacky sacks, which was a new thing I had never heard of because it used to be called kangaroo care. Zacky sacks help promote skin to skin contact. They also like to stock a lot of supplies into the babies under the little carrier it's in, and for the mom as well in the bathroom. That way, mom feels like she can take care of her baby in her room and doesn't feel like she needs to send the baby out to get the things it needs or to have to ask a lot. It just lets the mom feel a little more independent caring for the baby in room. So rooming in, one of the articles and studies that I used here, it talks about rooming in. It's a practice of enabling mothers and newborn babies to be together after birth, 24 hours a day. Rooming in has a lot of potential for helping baby bonding. It let the moms have a little more confidence in taking care of their baby on their own. It let them have a little bit of decrease in mental stress, knowing the baby's there, the baby's okay. Anytime they needed to check, they could see the baby. So there were a lot of benefits as far as bonding, and also the mom's mental status as well. So the study I did on rooming in, the study I looked at on rooming in with the babies, they had a little over 300 mothers in the study and about 333 babies. There was 10 pairs of twins. The families, the mother baby combo that qualified for this study were born in the month of January, and they were either late preterm or they were healthy term babies, because they try to eliminate factors that might make it harder to do room in, like health complications, being premature. You would be able to do that because you be in the NICU. Anything that might cause some complications in rooming in that might be an outlier that would affect the results. They eliminated those moms and babies. So 83.5% of rooming in moms were breastfeeding. Breastfeeding rate was higher in the couplets who practice rooming in. Rooming in was shown to be a lot more effective, about 20% more effective in initiating breastfeeding, because the mothers felt they had a better bond with the baby and a better connection, and the baby was more receptive to the breast. So other rooming in reported positive effects were the bond they felt with their baby, an increase in confidence caring for the child, and the ability to recognize a feeding cue. Is this baby want a pacifier? Are they gassy? Do they have a wet diaper? Or is this a hungry cry? Is this a hungry sound that they're making? So, also skin to skin. So, this is another thing that mother baby at Baptist encouraged. They never said no. They, occasionally suggested it. So, but there are some barriers in education and fulfilling the skin to skin contact with the mother and baby. So, usually it's a lack of staff. It takes, especially at the very beginning, a staff member stays with the mom for the skin to skin. But then you have to check in. You have a couple more rounds to go in there. Are they doing okay? Is baby breathing? Did mom fall asleep? Um, Lots of things like that. Also, moms are tired. Are they going to drop the baby? Is the baby going to fall down onto the blanket? So there was all these concerns with, doing that skin to skin. You have to be extra aware of your couplet and go in and check. There was also lack of awareness of how effective the skin to skin contact could be. They're like, oh yeah, it's good, is what I've heard, but it wasn't a full education on why it's good from some of the nurses. There was in the article that I've cited here also some lack of motivation to carry out the skin to skin contact from nurses, from tired moms, all around. There needs to be a little extra encouragement, this study shows, for skin to skin contact. So, what was observed versus what the studies tell us? So, we're focusing on bonding. And like I said, rooming in where I was at was encouraged, but the nursery was sold to the moms as a way to get rest. They were like, several times heard them say, you know, this is your first night with your baby. This is a great night to send them to the nursery. Try to get some rest tonight. Tomorrow's a busy day. Day two is typically when a pediatrician, OBGYN, everyone kind of stops by, lactation. You get pictures. You have a very busy second day on mother baby. So the first night is sort of, you've had a long day. You labored a long time. You went through a C-section. You've been in this hospital all day. Use the nursery as a way to get some rest. Well, it's been demonstrated that mothers who leave their baby in nursery overnight do not have longer or better sleep. Neither does the baby. So there's not truly a difference, according to research, whether you send the baby to nursery or you keep the baby in your room at night. So that was kind of an education point that I talked about, and we'll go over a little more about how I approach that with the nurses. But that was a big surprise to them because why wouldn't you think you would sleep better? Because, like we talked about earlier, moms have less like anxiousness, nervousness, like a uh, psychological help that they get by having that baby near them is like a comfort. So they sleep better because they're not like, is he doing okay? Is she doing okay? I haven't seen my baby in a couple hours. I wonder if they're getting fed. That little anxiety creeps up when baby's not near. So they lose sleep for that reason. Instead, waking up to feed the baby in the middle of the night, they're losing sleep either way of those options. They're not necessarily getting better sleep because their baby's not in the room. Now, there are some times when if a baby has something especially busy going on, that mom might get a little bit better sleep. But for the majority of babies sent to the nursery, them nor their mother get better rest at night. Also, what I observed was skin to skin contact was not ever discouraged, but they had these Saki sacks to help support the skin to skin contact, and they did not really use them very often. Occasionally, I saw it get out twice within my practicum hours for mothers. The Zaki sack, I'm going to explain, is you wrap it around your chest. It can be used for mother or father for skin to skin contact. Um, it has a double zipper to hold the baby in place. You wrap it around the baby, zip the first zipper, wrap the other part around you, zip the second zipper, and then it helps hold the baby in place against the skin. So, as we talked about earlier, the moms get tired. You don't want them to drop the baby, don't want to roll anywhere or fall under the blanket or anything like that to happen. So, you felt like you had to be extra attentive. Well, the Zaki Sack, it gives that extra support for a tired mom and also gives that baby that skin to skin contact. And also, this can be used for dad. Like I said, it's not gender specific. It helps give them a little support holding the baby. They feel a little more extra confident doing the skin to skin, not feeling like they have to hold and squeeze onto this baby the whole time. And it lets the baby get the benefits of skin to skin. The research tells us that the skin to skin touch between a mom and a baby um, can affect the baby's bond with mom even up to a year later. They were more close to their baby. Cleveland Clinic tells us that mothers snuggled their baby even more at pediatrician offices for visits later down the road once they had done that skin to skin as a young infant. There's quite a bond difference when you start that skin to skin early. So we had to overcome some barriers. So maternal knowledge of rooming in is most frequently encountered barrier. There are moms that are headstrong one way or the other. I've seen in my hours there. There are moms like this baby's not leaving my room. If you need to do anything with baby, don't let I'm not you're doing it in here, which is fine. We can accommodate that. There's moms that that send the baby away constantly and then you're worried, are there other things going on here? Why aren't we bonding with baby? Or are we wanting to bond with baby but don't know how? So there's a lot of education that needs to be done about why it's good to have baby in room and when it's okay, if you need some help to ask for help, if you need a 30-minute break, if you want them to give the baby a bath for you so you can take a shower. Um, it just all depends on your situation and it really comes down to communication between the nurse and education from the nurse to the patient. Other obstacles for baby bonding were mother's fatigue, felt like she couldn't give it her all. Cesarean sections or C-sections, as they're more commonly called and more easily called, I guess. Um, those sometimes there's some difficulties with that. It's very sore. Your abdominal wall has been cut open. Some women have unique incisions. I had one lady with a T incision, so an upside down T actually. So it went down and to the side. So she actually got cut up the center of her abdominal wall and then across. So recovery for her is going to be a little more difficult. She's going to be very sore. She didn't have the typical low cut. She had it up into her upper abdominal area as well. Her situation was a little different. Her baby did get stuck, but that is a C-section related difficulty that not everyone will have, but it did affect her ability to feel like she could get up and get to her baby as often as she wanted, which is very uncomfortable. And there's also nighttime. It's critical time for rooming in. It helps the babies bond with you, and overnight you learn more about what your baby needs, how your baby tells you what they need. But it's an obstacle because they're tired, and some of these moms have never had a baby up in the middle of the night, and they have to adjust to that. Luckily at Baptist, they do provide support 24/7, 365 for moms. If it's breastfeeding in the middle of the night, there's someone there to help you. So you do have a lot of support at the place that I did my clinical hours, but you definitely want to make sure that you're letting the mom know she has that support, because in the middle of the night, she's going to be tired. She's not going to want to uh, bother people. A lot of times I've heard moms say, I don't really want to bother you, but I'm just like, I'm tired. I don't know what to do. And they just need a little support. Sometimes it's something they know, but they just need a reminder because they're so tired. They're so wrapped around what does my baby need? So there's some barriers there, but majority of them can be overcame easily with just some education. So best practices for baby bonding is definitely skin to skin and rooming in. They work. We know they work. We have evidence that they work. We have research that they work. They do require staffing to be educated. It requires mothers to be educated by staffing. So there is some things to do, but luckily at Baptist, they have the resources. They just have to utilize them a little better. So let's do a bit of a reflection on the impact that I hope I had on this unit. So my clinical site, like I said, had all the resources to promote the rooming in and skin to skin. There was just a lack of education about the baby going to nursery. It was very much sold as this: you're going to get some sleep. Finally, yeah, do this, mom, if you need to. We will um, take you to the nursery to see them if you need to, but we can keep the baby all night if you want. So it was not that they wanted to just have the baby separate from mom. It was really out of that is what they were told to do when they first started doing mother baby nursing. It used to be that the baby was in the nursery a lot. All the babies went to the nursery. You would have several babies in the nursery, and they would stay there majority of the time. And several of the nurses spoke on that. There was like, we don't use the nursery like we used to, which is a good thing. It helps the bonding with the mom and baby, but they're still holding on some of that older education where you want the mom to rest, take the baby. But like I said, from the research that I went over, and I also provided to the mother baby educator and the preceptors while I was there, they don't really get better sleep. Baby doesn't get better sleep. There's more interruptions in the sleep for the baby, and mother has a sense of worry that wakes up a little bit more anxious and has some kind of some difficulties getting deep sleep when she doesn't roll over and see her baby. I mean, all moms are different, but the majority of moms in the study definitely fell into that line that they weren't getting better quality sleep with their baby in the nursery. And there was no difference essentially between your baby staying in the room and going to the nursery as far as rest and relaxation for mother or baby. There was also the lack of use of the Zacky sacks. And like I said, this is just, they were got in the habit of like, oh, I don't want to have to go get this and set it up and tell them about it. They get busy, and it's fine. Nursing, we get busy, and we sometimes overlook these things and why they're important. Especially the more you work in a unit, you get familiar, you get in a routine, and you forget to think about these things. Uh, so I just brought it up again, kind of talked to them about the Zacky Sacks. I gave them some information from the Cleveland Clinic about how touch is important, not only at the beginning, but it affects the bond later on in the baby's life as well. The newer nurses on the unit were definitely just forgot about it. They said, they just don't think about it, and they forgot that they had it in their school storage room. So they definitely thought it'd be a great idea, because the reason at night they were worried about doing a skin to skin, the newer nurses were, is it was like, well, what if she drops the baby? What if the baby slips? So it's just a re-education and kind of a reminder that this resource is available to them. And like I said, I printed off the articles and I gave them to the mother baby educators and let them know kind of where, you know, the new research sits on, especially the nursery thing, because that was kind of the bigger thing. They were proponents of the Zacky sacks. They just forgot to use them essentially. Um, but there's no reason to encourage mom to send the baby to nursery for rest. And that's something they were intrigued about, and definitely said that they were going to talk more about as a unit. So here I have some of my references. Like I said, we had skin to skin contact and healthy neonates, the barriers and enablers to skin. And we talked about the Cleveland Clinic giving us some information on the benefits down the road of skin to skin contact. The article that I found most valuable as far as rooming in was definitely overcoming rooming in barriers. This survey they did about mothers rooming in is kind of where we first saw that these moms weren't getting better, longer, deeper sleep when their babies weren't with them. So that is my presentation. I hope that you enjoyed it, and I really hope that I was able to make an impact on the mother baby unit.